Hello, my name is Kayla Sherman, and I'm going to be speaking about Parkinson's disease. I'll be discussing the prevalence of the disease, risk factors, signs and symptoms, pathophysiology, assessment tools, interventions, medications, and management of this disease. Parkinson's disease is a degenerative chronic disorder of the central nervous system in which nerve cells in the basal ganglia degenerate. Parkinson's disease is the most common neurodegenerative disorder after Alzheimer's disease. It occurs in both men and women, and symptoms progress with age. The onset of the disease is usually at age 59. The areas that are the disease's most prevalent is Europe, North America, and South America. There are 4 million people in the United States that are affected by Parkinson's disease. The biggest risk factor for Parkinson's disease is age. The older the person is, the greater the risk. The disease typically peaks at age 80. Environmental factors have also been associated with this disease. These would include pesticide exposure, prior head injury, rural living, beta blocker use, agricultural occupation, and drinking well water. Family history is also a risk factor. Loss of neurons in the substantia nigra of the brainstem causes reduction in the production of dopamine. Dopamine is needed for fine motor skills, smooth muscle movement, and emotions. This deficiency causes denervation, hypersensitivity to receptors. This occurs in the SNPC. This area is in the ventrolateral tier where neurons project to the dorsal putamen of the striatum. This is the reason why the motor features such as bradykinesia and rigidity occurs. Lewy bodies is also part of Parkinson's disease. Aggregation of abnormally folded proteins become insoluble and aggregates to form intracellular inclusions within the cell body and process of neurons. This is not restricted to the brain, but can also happen in the spinal cord and in the peripheral nervous system. This is said to be one of the reasons the neurons die. Another feature is neuroinflammation. Astrocytes and microglia are responsible for clearing out extracellular debris, which helps the neurons survive. In Parkinson's disease, these cells activate, causing inflammation, and this is harmful to the neurons, creating neuron death. The 4 major signs and symptoms are bradykinesia, rigidity, tremors, and gait changes, such as imbalances and incoordination. The typical gait of a Parkinson's patient is stiffness, shuffling gait, incoordination, and a tendency to fall backwards. Cognitive impairment, sleep disorders, pain, and fatigue is also associated with this disease. There's no specific test to diagnose this disease. A thorough history needs to be performed. The main diagnosis of this is present of symptoms, typically the bradykinesia and the rigidity. Research is being conducted to better diagnose Parkinson's disease. To help with diagnosing other conditions, PET scans can be performed. To decrease risk of Parkinson's can be drinking coffee, NSAID use, calcium channel blocker use, and alcohol. This has been shown to decrease the risk of developing Parkinson's disease. So far, there is no cure. There's only symptom relief with the use of medications. There's also a deep brain stimulation, and in severe cases, thalamotomy, or the removal of a group of cells in the thalamus. Stem cells have also been used along with fetal tissue transplants. The biggest for nursing care is education on the disease and on the medication that the patients are currently using. This type of patient is also a fall risk, so this needs to be monitored while they're getting care in the hospital setting. The medication that are used are those that enhance dopamine or stimulate receptors. These include levodopa, dopamine agonist, monoamine oxidase type B inhibitors, and amantadine. Otherwise, focus is on treating other conditions associated with this disease, such as depression and adverse reactions to the medications. This includes nausea and impulse control disorders. Management with this disease is through education and medication. Patient and families need to be educated on the medications, the disease progression, and the different side effects of the treatment. Another thing to consider is community resources such as transportation, home care, and meals. Swallowing needs to be monitored along with communication. The patient needs to be prepared for the role changes as well. Psychiatry may be need to be contacted later and within treatment. Well, I hope that you found this presentation informative. If you have any questions, feel free to contact me, and thank you for listening.